If your patient presents with shoulder pain, take a thorough history. Inquire about occupational and recreational activities, a history of recent or remote trauma, as well as any abnormal use in the recent past. Shoulder pain is a common complaint. The pain may originate from many sources, including the glenohumeral or acromioclavicular joints, periarticular structures such as the rotator cuff, biceps tendon, or surrounding bursae. Non-articular causes of shoulder pain include neurologic causes such as thoracic outlet syndrome, nerve entrapment, or cervical radiculopathy. And finally, the pain may be referred from other thoracic abdominal structures, for example, angina pectoris and gallbladder disease. If the routine screening exam reveals an abnormality, provocative testing may be required. These tests may help distinguish between arthritis, ligamental instability, nerve impingement, bursitis, or tenosynovitis. The shoulder joint includes several bones: the clavicle, the acromion, the scapula, and the humerus. There are 4 articulations: the sternoclavicular articulation, the acromioclavicular or AC articulation, the glenohumeral articulation, and the scapulothoracic articulation, which is not a true joint. The glenohumeral joint is the main articulation of the shoulder and is a ball and socket joint. It is an articulation between the glenoid fossa of the scapula and the humeral head. The socket is relatively shallow, allowing for movement in several directions. There are several ligaments and tendons that stabilize the joint, including glenohumeral ligaments and the rotator cuff muscles. The rotator cuff consists of 4 muscles which help with shoulder movement: the supraspinatus, which assists with abduction, the infraspinatus and teres minor, which assists with external rotation, and the subscapularis, which assists with internal rotation. Physical exam of the shoulder begins with inspection. The patient should be disrobed to the waist so that the shoulders are exposed. The examiner should inspect the shoulder for asymmetry, swelling, muscle atrophy, scars, and deformity. The presence of these abnormalities may give clues to a shoulder disorder. Next, palpate the shoulders. You should start at the sternoclavicular joints and palpate along the clavicle, radiating outward towards the AC joints. Tenderness or bony enlargement of the acromioclavicular joint may indicate acromioclavicular joint arthritis. Next, the glenohumeral joint should be palpated. The glenohumeral joint lies just medial to the humeral head and just below the coracoid process. The scapulothoracic articulations, as well as the subacromial bursae, should also be palpated. Next, perform range of motion testing. Passive abduction of the shoulder is 90 degrees. Internal and external rotation may be examined several ways. Once the examiner performs passive range of motion, the patient should be asked to repeat these movements on their own. This independent movement tests active range of motion. A rough way of testing intact internal and external range of motion is to have patients put their hands behind their head and subsequently behind their lower back. 2 additional provocative tests may be performed to evaluate for nerve impingement and supraspinatus abnormality. To test for impingement, perform the Hawkins test. With the patient's arms forward flexed to 90 degrees and the elbow flexed at 90 degrees, the patient's arm is then internally rotated. The examiner places a hand over the scapula to restrict scapular movement. The arm is then internally rotated. Pain reproduced with this motion is caused by impingement of the greater tuberosity of the humerus against the acromion. The empty can test examines the integrity of the supraspinatus, one of the main shoulder abductor muscles. To perform this test, the patient's shoulder should be abducted to about 90 degrees and forward flexed to 30 degrees with the arm internally rotated so that the thumb is pointing straight down. A hand should be placed over the scapula on the affected side. Resist abduction with the other hand.